Hello, I'm Dr. Rohini. So today we are going to talk about what are the do's and don'ts after an embryo transfer. So let's begin with the first question. How much rest is required? So immediately after the procedure, we would be giving you a bed rest of 30 minutes. That is more than enough. It's not advisable that following embryo transfer that patient should be completely bedridden or should be completely lying down the whole day. Not at all. After this 30 minutes, we advise the patient that they can walk around, they can do their normal activities. And a lot of patients have this doubt that whether they can travel or not after the procedure. So yes, traveling is definitely allowed. There is no problem with traveling after the procedure. If you are coming from a far off place, definitely we advise that you take a car or take a less stressful way of mode of transport, and you can travel back to your hometown or wherever you stay. So till you wait for your UPT, urine pregnancy test, or beta HCG reports, in that meantime, which is around 2 weeks, we advise that you do daily activities, you do your household work. If you are working in a job, if you are working in a company, you can go to your job also. So now next, what are the things not to do? When not, what kind of activities we tell you to avoid? So we advise that you don't do any strenuous activities, that is like lifting any heavy weights. When it comes to household work, we advise not to do works which requires a lot of bending and any other strenuous activity like that. And next, what kind of exercise is allowed during this period? So any moderate walking is allowed. You can walk for we advise patients that you walk for at least 30 minutes in a day. And yes, we do tell our patients that please avoid heavy exercises like aerobics, Zumba, or weightlifting. For these periods, just take it little bit easy and not do these heavy exercises. Next, we advise patients that they should have a adequate rest in this period. They should take good rest. And next, what we have to talk is next is what kind of food is advised at this period. So what food you should take and what you should not take. So during this period, take a healthy diet, which comprises of good vegetable intake. So we advise that you take salads and eat a lot of green vegetables. Have a high protein diet, that means like with pulses, with dal, with sprouts, and you can have carbohydrates like rice, chapati. Yes, during this period, we advise our patients to avoid certain items like papaya, pineapple, caffeine, and lot of sugar. We ask patients to avoid a lot of sugar intake, because a lot of medications are given at this period that itself might increase the blood sugar. So it's better to avoid high sugar intake to prevent infections. Other than that, we ask our patients to avoid oily food, spicy food, which can cause stomach upset, and also avoid food with a lot of maida, like bread and all these things, which may induce your constipation. Because one of the things that we tell patient is that they should not strain during this period. They should not have constipation. So how to avoid constipation? Take a lot of green vegetables, drink lots of water, at least drink 2 to 3 liters of water during this time. And it's also very important that in this period you have a very positive outlook. Try to reduce your stress levels by doing meditation, listening to some good music, reading some good books, because all these things also play a very important role in implantation. And also during this period, we advise our patients they stick to the medications that they are given. Make sure that you take your medicines on time, don't miss on any doses. And if you face any problem with taking any of the medicine, or you feel you're having any discomfort, then you should come to hospital and we'll change the medication accordingly. So next, when between this period, when should you report to the hospital? There are few warning signs that we tell the patient, that in case they have a lot of nausea, vomiting, a lot of stomach upset, abdominal pain, or in case they have any heavy bleeding, this is the time then you should call us up, or you should come directly to the hospital and visit us. And also, in case if you have any cough, cold, fever, and in case you go to some other doctor for some other health issues and they advise you on starting on any medications, we would want you to come back and consult with us whether those medications can be started or not, so that in case if we have to alter any dosages of our medicines, that would also be done. So I think I have briefly spoken today about few of the doubts that most of our patients have, what to do and what not to do after embryo transfer. In case if you have any further doubts, you can always reach us on our website or can call us up or can come and directly visit us.